All right, welcome back, and thank you for staying with us. So we are talking about the fight against malaria in the country. And this particular morning, I'm engaging Dr. Willis Ahwale, advisor and Malaria Council, and also joining us virtually from Mombasa Counties, Dr. Eric Ochomo, senior research scientist at KEMRI. And Dr. just to pick up from where you had left before we went on break, Dr. Ochomo, you were talking about this new species of mosquito that has been reported in the country. I want you to just pick up from where you left. Why is it unique? What are some of the unique traits, and why should we be concerned? The other day I was having I did a bit of research about this, and you were saying, as a scientist, that the spread of malaria is no longer going to be seasonal, but it's something that, according to the characteristics of this new species of mosquito, it's something that is concerning, that it could just be all year round. Is that something that you have already established?
Yes. Yes, this new mosquito, as I mentioned earlier on, it's not like our traditional mosquitoes that would wait for the rainy season to sort of blow up in numbers. I mentioned that it breeds a lot in what we call artificial habitat. So if for example, think about any home scenario. Many of us will have a reserve tank for water. So whether it's an overhead tank or it's a tank that's for trapping rainwater outside, many of those tanks are not covered. So that is a very good breeding habitat. Think about people who have, for example, cars, and then you have car tires lying around somewhere in the compound. That's a very good habitat for mosquito. Think about drainage, and especially in areas like Nairobi or Kisumu or Mombasa, any of these really large cities. We have a big problem with drainage. Very often they get clogged, and we have some water that's staying there stationary for a bit of time. That is a very good breeding ground for stiff insect. So if you think about it, the traditional mosquitoes would wait for the rainy season when you have lots of pockets of water for them to breed. But these ones will always have they'll always have somewhere to breed because of the way in which we retain water, either knowingly or unknowingly. And that is the reason why we will in the dispensation where we see this vector spreading through the country, we will have malaria transmission throughout.
All right.
Now, let me also mention something else that we worry about. So at the moment, we have seen the mosquito in Marsabit, Turkana, Mandera, and potentially Elgeyo Marakwet, meaning that it's spreading and it's coming down. It's coming down towards potentially our big urban settings. The one that I worry about the most is Nairobi, for example. If it does get to Nairobi, there's a huge proportion of people that are in Nairobi that are constantly moving between, say, Western Kenya or coastal Kenya and Nairobi, meaning that they could be bringing in malaria parasites. As they do so, this mosquito will start thriving in these same environments. So there's a chance for local transmission of malaria in areas like Nairobi. When that happens, there's a very big proportion of people who live in Nairobi who've never been exposed to malaria before. So we call them naive populations. They have absolutely no immunity against malaria. And people like this tend to get very severe infections or even complicated forms of malaria like cerebral malaria. And this is why we're really worried about
all right, Dr. Thank you for saying that, because we have Dr. Ahwale with us in studio this morning. And I just want you to also weigh in on this particular matter. Should we be concerned? Because we were at a space where we were feeling like we were almost getting it right. We had a vaccine that was approved the other day and launched for use in the country. It's sort of like we were heading in the right direction. Receiving this news, what does it mean from where you sit?
Yeah, let me say, yes, we should have some concern. This is a threat, but it's not the only threat. Let me really make the point that the emergence of Anopheles stephanesi should not be considered as the only biggest threat we have in the war against malaria. From where I sit, and in the past 10, 15 years, if you observe, the threats we really need to deal with, number one, we have resistance to commonly used insecticides, which has been spreading, meaning that even some of the nets that we are using, the insecticides there, the mosquitoes are resistant to them. And as Dr. Ochomo has mentioned, the Anopheles group of mosquitoes, you have what you call Gambia and Funestas, which to me are even more efficient transmitters of malaria. Because first, they predominantly bite human beings. Secondly, they have lived in this environment, and they are able to bite both indoors and outdoors. So the threat of the fact that even the traditional vectors, there is resistance to them, that's a problem. Now, number two, we are also seeing emerging resistance to the medicines that we use. The medicines are important because that's what will treat and also kill what we call the gametocytes that are then transmitted. That's another major threat that we do have. Climate change is another threat that we have because due to deforestation and other areas, then we are getting breeding sites in places that were not even there. So we must consider all these as threats and address them as one. It will not be very wise to isolate and say Stephenesi is the biggest threat and deal with it alone. And I'll also just say something about mosquitoes. We have about 4,000 types of mosquitoes grouped into about 8. Now, the Anopheles mosquitoes, even among themselves, what we call the rate of transmission of malaria varies. And it is measured by what you call human biting indices. Mm-hmm. How many bites per person per night, for example, over a month? And the traditional ones, the Gambe and Funestas that we currently have, number one, have very high biting rates. Number two, they also transmit a lot of what we call the sporozoites. That's what they inject to cause the disease of malaria in the body. So for me, even as we look at Stephenesi, we should not just assume any malaria that will increases and surges will only be because of Stephenesi. The truth of the matter, they'll start competing. And in fact, in some areas in Ethiopia and even parts of Djibouti, even as Stephenesi came, and you studied what was really causing most of the malaria, it was found to be the traditional ones. So what I'm basically saying, yes, this may be a threat. We understand it breeds in dirty water, so it has a potential to spread into urban areas. Mm-hmm. But we must not also forget where the burden is highest so that we don't start putting resources in an area that does not have the highest burden.
Dr. Ochomo, what do you think, though, if you can share with us what has happened elsewhere? Is there any evidence that shows that there is nexus between, the presence of this new species of mosquito, the Anopheles stephensi, and, the increase, the surge in the cases of malaria that have been reported in that particular region? Is there evidence that can connect?
So for the strongest evidence that we know of is probably in Djibouti, where before the introduction of stephensi, they had about 30,000 cases. They were actually in the pre-elimination phase. And about 2 years ago, they reported 73,000 cases. So, 70,000 extra after the introduction of this vector. So it is a potent vector, but as Dr. Kwale has correctly said, we have our traditional vectors. And those ones are also changing in ways that may affect the ability of our traditional tools to work well. And I think there needs to be a very collective look at everything that's going on in terms of the transmission landscape, so that when we prioritize funding vector control, the distribution of medicine and diagnostics, it's done in a way that addresses where we have the greatest burden and where we potentially would have the greatest gains. Gains depending on the investment.
All right. So which direction should we go? Because even Dr. Ahwale has, talked about the resistance to local insecticides. There's also concerns about the current treatment that we have and the trajectory that these mosquitoes are taking. What do we do then in terms of addressing those kind of trends? There was a vaccine that was unveiled the other day. It is now currently being used. Then there is this news that you are reporting as scientists. How do we go about that so that we are at par, or we stay ahead of whatever it is that is happening in this particular space?
Yeah, so one, I think we have to invest a lot more in our surveillance. Surveillance here meaning that we need to be able to figure out the scope of distribution of different vectors, including this new vector. We must, as we do so, try and incriminate, figure out which vector is contributing more towards the transmission, and invest in being able to control that vector or that group of vectors in the different settings. That's one. Number two, we have to do a lot of research to try and figure out if we have any mutations that might be leading to resistance to our currently used medicines in malaria. We need to figure out where that is happening. I mean, what has been reported now in our neighboring countries, Uganda and Ethiopia, is certain mutations that might mean that we may not be able to detect it using our currently used rapid diagnostic tests. And in some places, medicine that we currently use may not work. We need to establish what that burden is. We need to establish what alternative medicines we can use in those instances, and what else we can have what other additional tools can actually work in this space. And let me just mention a little bit what we're doing as KEMRI here. Part of what KEMRI does is a lot of research on novel mosquito control tools and novel medicines. And so we currently have evaluated what are known as partial repellent devices. We have evaluated what are known as attractive targeted sugar baits. And these are basically new ways of delivering insecticides to mosquitoes. That is not the traditional ways where you had someone sleeping under a bed nest. So for example, if you have a partial repellent in a house, the entire house is protected of mosquitoes, whether or not someone actually uses a bed net. So these are some of those additional tools that I think we can add, but there's a lot of investment we need to make into surveillance to figure out where our investment makes the most sense.
All right, Dr. Hwale, your thoughts on that as well. The interventions to end malaria, are they currently under threat? Should we be concerned as a country? Because you're talking about, treatment not working, the insecticides not working, should we be concerned that
yes.
what we have is no longer a tool that we can use against this insect?
Yes, we have threats. And now this is just one of those joining the threats. Yeah. And as I've said, these threats we should have an integrated approach to addressing all these threats, not addressing each threat separately. We need also what you call multi-sectoral approach towards malaria, because malaria goes just beyond the real medicine. Huh? And I'll give one example, like what we really, in my opinion, we need to do right now, is that with heightened surveillance, there are two aspects that I would want. In areas where we identify Anopheles stephanesi, these are areas we need to do what we call larviciding and larval source management. Because once we identify that, we must make sure we kill the breeding sites. So we are not only just doing surveillance for the purposes of reporting and publishing, but we are also doing it because we want to ensure that there is no further spread. That is called. So surveillance should go beyond that. And the other thing about surveillance is trying to look at those characteristics that make the new species maybe transmit. Because the literature so far, you will realize this stephanesi also tends to bite other vertebrates. They may bite monkeys, baboons, buffaloes, cows, and not necessarily a lot human. The current ones are a lot more towards. Now, let me also then say the threat of the other type of malaria known as vivax. It is not as deadly as falciparum. It doesn't cause a lot of complication, but it runs a chronic course. And the treatment is actually not as expensive as for falciparum. You could even use tetracycline. There's the challenge of relapse. It may remain in your body for a bit of time, but it will not give you those complications that could easily lead to death like what we have. And then let me also then really say, I think integrated approach where you have what you said, the issue of vaccines, where you have better treatment, where you have indoor residual spraying, where you use now nets that are new generation, that you have mixed insecticides in them. This is the approach we should go. And then finally bring in other sectors like education, agriculture, because land use has a lot to do with how malaria is also transmitted. In some of the areas like in Western Kenya, even keeping your cattle and cows very close to your homestead, the hoof of a cow on a rainy season, once the water settles and is clean, is enough for the Anopheles gambian funestas to breed there and harass an entire village. Yes.
All right. Dr. Ochomo, Now that, this discovery has been established, what are you doing as Cambria scientists, beyond just knowing that it's there and it's unique, it's different, it poses a bigger threat? What is it that you're doing just to give the populace an assurance that we are not all that bad off? I mean, what is it that is being done? Because you've also shared concerns about the treatment, that sometimes are no longer working and all that. So what is it that you are doing in that regard?
Yeah, I had already mentioned earlier on that one of the things that we've been doing very actively is trying to test new interventions, new tools, so new medicines, new insecticides, new approaches towards the delivery of insecticides, like I mentioned, special repellents and ATSPs. On what Dr. Kwale has just mentioned, the multidisciplinary approach, there is also a very strong move towards what's known as integrated vector management, where we are looking at different stakeholders. So people that work in, for example, road construction, just letting them know that when you excavate maram off of a site and you leave a hole and that has water, then there's potential for mosquitoes to be there. So there's a very strong move towards integrated vector management, where we're looking at engaging different stakeholders, letting them understand how the different things that they do could have implication for increased transmission of malaria. But at the moment, our biggest investment is in research, so trying to identify all of the different vectors that are in these areas and their potential contribution to transmission.
All right. There's also, concern that this, type of mosquito spreads very fast. What are the chances that it could be reported somewhere else other than the counties that you've mentioned? And what should Kenyans begin already doing? What can you advise, Kenyans to do so that they can be able to protect themselves and their environment?
Yeah, great question. Let me just mention that the things I'm about to say actually apply across many types of mosquitoes. I mean, we've had maybe about a year, 2 years ago, where people were in Nairobi complaining about getting lots of mosquito bites. And that is the typical Culex Aedes mosquitoes that we know exist in Nairobi, thrive in Nairobi, because of the way in which we dispose of our waste. So as I mentioned earlier on, this mosquito prefers artificial breeding habitats. For that reason, any water that we keep in our homes, whether you have a 100-liter jerry can of water that's inside of your house, or you have an overhead tank, or you have a tank outside of your house, ensure those tanks are properly covered. And if they have any holes, for example, the overflow pipes, make sure you put a gauze wire so that there are no mosquitoes that can go in and breed there. In fact, oftentimes we complain about mosquitoes that we ourselves are the ones that are responsible for in terms of creating the habitats for them. Number two, proper refuse disposal. So things like tires, things like plastic containers, bottles, etc. We have those littering our environments everywhere. And those ones are very good at trapping water. That little bit of water that is trapped in a bottle or trapped in a tire is very good for breeding, for mosquitoes to breed in. So those are things that we can actually do as individuals to try and control the mosquitoes in our environment. The other thing I want to mention is that, so sometimes there's also the exposure that comes with being in areas where you're likely to get bitten in the evening. So we can use personal protective measures like personal topical repellents, for example, to try and ward off any mosquitoes that might be biting you at that time. Importantly, and for malaria, anytime you feel sick, you feel like you have any symptoms of malaria, it's very important that you actually get a proper diagnostic. Go to a health facility, get tested. Once you confirm to have malaria, then you get the proper medication and make sure to complete your dose. These things we're talking about, like, for example, the development of resistance against medicines is driven by our adherence to medicine. So you're given medicine, you're told, take 4 tablets every day for 3 days, but on the second day you feel fine and that's it, you're not taking the rest of your tablets. What is happening is that the parasite that was inside of that had infected you is not dead. So therefore, it mutates. It gets used to the medicine, and over time, we end up with a situation where that medicine may not work for you anymore. And so it's very important that anytime you feel ill, you actually go to a medical center, you get a proper diagnostic, and when you have medicine, you take all your medicine as advised by your doctor.
All right, thank you for that. Dr. Hwale, also just to weigh in on that as well, and also tell us how it has been working in terms of just bringing the communities also into this table that we are discussing these particular interventions, because there's been concern about this sluggish uptake of some of these interventions, the advice that is issued, some of them do not take it very seriously. I mean, how has that space also been, and what is it that you are doing to be able to empower the community to begin to appreciate the depth of this particular crisis that we are talking about, and what are you seeing in terms of how they are receiving this information?
Yeah, thank you for that question, Safin. I think the role of community in malaria control and malaria elimination is very crucial. Until communities own this as their biggest challenge, until they own the interventions, until really they are the ones on the forefront to fight malaria, then a lot of the efforts that are being put in place will not be sustained. So two things, community involvement, and this looks at behavior change communication. That these tools are there, how do you use them? How do I identify fever? How does a pregnant woman go to ANC? So I know the role of what we call social and behavior change communication campaigns are very crucial to ensure that there is an uptake of these interventions at community level. There is proper utilization of those interventions, including the nets, including the treatments. And then also very important is that the role of what now we are calling community health promoters is going to be very, very key in ensuring that they are able to identify these diseases. I think the plan that the government has in engaging community health promoters, in particular, if they can be empowered to even do diagnosis at community level, that will be key. The other role that communities can do is the stagnant pools of water. They can also do surveillance in terms of going to identify areas where mosquito breeding is taking place, and then be able to either larvicide, meaning you are spreading a chemical or a compound that stops the breeding, and also then having a good referral system that people have been identified should be taken to the place where they get the right treatment. Those with complication move. So communities must own malaria control intervention at the lowest level. It's very, very key, and we look forward towards that. Now, let me say about urban, and Nairobi in particular, because the other urban centers, Mombasa has malaria transmission, Kisumu has malaria transmission. In Nairobi, the challenge, as Dr. Chomo has said, is what we call non-malaria vectors. Aedes, these ones that bite you and you want to scratch yourself, coolicides looking like helicopters. Those are due to rubbish heaps, broken sewer lines, and uncollected debris like stones that are used in construction site. The most important thing to do, and so that we are prepared that then Stephenesi does not come here, is to enforce the Public Health Act. These things must be cleared. We must repair our sewer lines. Rubbish should not be thrown all over the place. That would be the biggest danger. But it is in our power that we do something before this becomes a true threat.
All right, before it becomes a true threat, I feel like it's already a threat, you know, going by what you said earlier. But coming back to you, Dr. Ochomo, you know, there is a lot now happening. The way forward from earlier on was the fact that Kemri now is escalating this investigation to find out whether this mosquito has gone to other areas. Probably would tell us more about what your action points are going to be going forward as you continue to investigate this new species of mosquito. What is it that you will be doing in the few days that is to come? And should we expect that probably the numbers of the counties would go higher than just 4 that you listed earlier?
Yeah, a good question. So at the moment, we really haven't been able to establish the role of Stephensi. Even though we've seen it, we haven't really been able to establish its actual contribution to malaria. And that is something that we are working very hard to try and do. In the areas where we've actually discovered, there are other vectors that also thrive alongside Stephensi. For example, in Marsabit, where we worked, there was RRBNCs collected alongside Stephensi. So even though there was active transmission of malaria, we're not sure which mosquito is actually involved in the transmission. So that is the one thing that we want to try and tease apart initially, so that we understand the actual contribution of each of these different species of mosquitoes. On the same note, for Anopheles stephensi, because it's now just invading many parts of Kenya, we do not understand its behavior. And its behavior here would mean, where is it resting? What time is it biting? Who is it preferring to bite? So those are things that we know from literature in other places, but as a mosquito moves to another place, it adapts differently. And so those are things that we want to try and tease out. And they're very important because where a mosquito bites people, or when a mosquito bites people, I mean, in terms of the time, and where it bites people and where it rests is very important in determining what tool we're going to use to try and target it. And so those are the questions we want to try and answer at the moment. We are also doing risk mapping, where we are going to these different communities, trying to identify where we have this vector and where we don't. Importantly, we are working with the National Malaria Control Program to also train local experts. So local community health promoters, as Dr. Kwale had mentioned before, but also local entomologists, just so that there's that capacity built, so that one, they can recognize the vector when they see it. And our team at Cambry has what's known as molecular capacity to help them really identify that is the correct vector when they do identify it. But at this point, it's a risk for the entire nation, and we can only do so much as Cambry. And therefore, at this point, we're really collaborating with everybody at the county level, everybody at National Malaria Control Program, to try and make sure that we can identify where the vector is and how much it's actually contributing to transmission. On the other hand, we are also now starting to test these different tools that we have for mosquito control to identify what might work against this species, as well as other species, in a way that collectively makes sense. As Dr. Kwale had mentioned, we cannot just target one mosquito and think that we would actually achieve malaria control. We must look at this thing holistically. We must ensure that we're targeting all the mosquitoes in an area. We must make sure that we are targeting, we are providing effective medicine and effective diagnostics in these communities.
All right. Thank you so much for saying that. All right. And that, unfortunately, we are going to end it there for now. Of course, this is a conversation that we can escalate and talk about. There's a lot to discuss when it comes to the steps that we have made in as far as fighting malaria is concerned. But today it was just about that threat, that emerging threat of the new mosquito species that has been reported in the country. Actually, there's, from Cambry, it's not the first time that this is being reported. Last year, it was reported in 2 counties, and actually now also fears that Elgeyo Marakwet could have been part of the counties where this mosquito was reported. And also lately, this particular species of mosquito has been reported in the county of Mandera. We want to talk about we want to close, of course, and I'll give a chance to Dr. Akwale, the advisor of End Malaria Council, as we close this particular conversation for today. What is it that you tell the viewer in as far as, where we are at in fighting malaria is concerned? You've talked about the interventions, and also as the End Malaria Council, as we close this conversation, what would you say has been your biggest achievement?
Yeah, so thank you very much. I think the fight against malaria, first and foremost, requires resources. It requires money to get all this intervention, to do the surveillance, to ensure that this reach the people. So one of the things is strengthening or accelerating resource mobilization, both domestic and also from external partners. But we look forward towards also really enhancing domestic resource mobilization. The other thing that we need is to continue advocating for malaria so that it is top on the agenda. Malaria is still the most common cause of outpatient attendance. It kills almost 12,000 people annually. This is twice what COVID actually did. But because I think it kills more children and women, we don't talk so loud about it. I think just continuing to advocate that malaria should be a major agenda as we do our planning in this country, it will remain very core.
Thank you so much. And Dr. Ochomo, your parting shot?
Yeah. So mine is just to emphasize the role of communities, the role that everybody has to play in this. The things we mentioned about how we manage our waste disposal, how we manage any water containers we have in our homes. I mean, a lot of it is going to be what you and I choose to do in terms of trying to control the vector. Number two, as I mentioned before, if you feel you're ill and you potentially have malaria, do not go to the pharmacy and get medicine. Get tested. And once you're tested and you get medicine, make sure you complete your doses. Those are very, very important for all of us who may be exposed to malaria.
Thank you so much, Dr. Eric Ochomo, Senior Research Scientist, Kemri. Also in studio with me this morning is Dr. Willis Ahwale, Advisor and Malaria Council. Thank you so much. Of course, we will wind it up there. Thank you for creating time for Daybreak this morning. My name is Safin Achieng Oma. Always a pleasure for you to do this for you each and every morning. For now, it's a wrap. Have a lovely day ahead. Of course, some of the stories we are following up for you include that hearing of the Finance Act case that is happening this particular morning. A 3-judge bench is beginning that hearing this particular morning, something we will be bringing your way any minute from now. So do stand by for that and much more. Have a lovely day.